Okay, so today we are going to be discussing about the anterior dislocation of shoulder, and it is of four main types. Okay, it can be preglenoid or subcoracoid, subclavicular, intrathoracic, but the most important ones are the subcoracoid and preglenoid. Okay, the subcoracoid one is the most important, in which the anteriorly dislocated shoulder comes to lie below the coracoid process. Okay, so what will be the attitude of the patient? The position in which the patient would be, holding his arm, his shoulder would actually be abducted and externally rotated. And how is that going to present? The arm would be by the side of the body. Okay, and now what are the signs on clinical examination, on inspection? And so basically when you will see the shoulder contour would be flattened. Okay, this is a very important thing on clinical inspection. Now, what are the tests, the clinical tests to confirm? Okay, so there are four main tests. We have the Hamilton's ruler test. They come in MCQs. Okay, the Hamilton's ruler test, the Dugas test, the Callaway's girth test, and the Bryant's test. So what happens in Hamilton's ruler test? Basically what we do is that we take a shoulder, we take a ruler, and we see whether the acromion and lateral epicondyle of the humerus are touching. Okay, and then we have the Dugas test, in which we ask the patient to touch the opposite shoulder, and he will not be able to touch his opposite shoulder. And then in Callaway's test, you measure the girth of the affected shoulder, and it would be increased. Okay, and then in Bryant's test, we take the vertical axillary circumference, and it is also increased. So in basically students mix the Callaway's and Bryant's. In Callaway's we are taking the girth, and in Bryant's we are taking the vertical axillary circumference, and both of these are increasing in anterior shoulder dislocation. Okay, so basically we also have to look for axillary nerve damage because it is present in that region, but the thing is that we cannot assess for its motor part because already the shoulder is dislocated and the patient cannot move it. So we only check for its sensory component in the regimental batch area. Basically there is this, in the deltoid region, there is sensory loss, and that is the regimental batch sign. If the sensory loss is present, and we say that the regimental batch sign is positive. Okay, and now in X-ray, we are basically, which view are we going to do? We are going to do a lateral view or an axillary view. The AP view is useless. Okay, why? Because it can tell you about a dislocation, but it won't be able to differentiate between an anterior or posterior dislocation. Okay. Okay, now if along with the shoulder dislocation you also have bone trauma, or periosteum is compressed, then we call it a Hill-Sachs lesion. So these were the basic notes of anterior shoulder dislocation, the basic tests and the types, and how the patient is going to present with an abducted and externally rotated shoulder.